Welcome back, everybody. It's time once again for another Health Talks with Dr. Trinh. The one show, maybe the only show, that tries to not only update you on the latest in what's happening in the world of health and feeling better, but tries to answer some of your questions and turn complicated issues into easily understood ideas. So let's see if we can't learn something today from the man who teaches so many, Dr. Trinh. Hey, good morning, Dr. Trinh.
Hey, good morning, guys. How are you guys?
I'm feeling good. I'm sure your guest is feeling good. She looks bright-eyed and alert here, much more than I am this morning here. I'm still
I had a call before this.
Oh, okay. I'm still bleary from everything that's going on here. I think we have one crisis, and now we got another crisis on top of a crisis here. I mean, how many can we handle here all at once?
It sounds like we all just forgot about COVID.
Yeah, right.
It blows my mind a little bit, to be quite honest. I mean,
it's whatever's
it's a scary
in the news
time
today.
out there.
Yeah, exactly. And next week there'll be will there be more? And then there'll be alien invasions and asteroids from outer space, and I don't know.
Killer hornets. I've seen killer hornets.
Killer hornet. Yeah, that's right. Exactly. Murder hornets. Murderous hornets arriving in the U.S. They said the other day. Yeah. Oh my goodness. Well, today you're going to talk about a topic that's near and dear to you, Dr. Trinh. You're going to talk about, as I understand it, the current state of global research into Alzheimer's. Have we learned anything? And who did you bring along to discuss this today? It's going to take half the show just to explain her credentials and her title here. I know that much here.
Yes, Lisa is on, and she is a good friend of mine from Global Alzheimer's Platform Foundation. Lisa, you're up. Tell us what you do and what is GAP?
The Global Alzheimer's Platform Foundation is a global non-for-profit, and our mission is to move the needle on Alzheimer's research, get a cure, get treatments faster.
Well, that sounds so simple. When you explained it beforehand,
it really is. That's our goal.
So how are you meeting this goal? Where do we stand today in that goal? Are we any closer than we were last month, last year, last decade?
We're definitely moving forward. It's an interesting time right now, and I know Dr. Trinh can really attest to that. Notoriously, clinical research is always really, really slow in not just running clinical trials, but approvals and bringing quality medications to market. One of the interesting things is that with COVID-19, it has changed the clinical research environment in a lot of interesting and a lot of scary ways, to be quite honest, but also some very positive things. One of the things that I really enjoy seeing is that the virtual and remote capability that private practice and healthcare has enjoyed for the last 5 years is moving into the clinical research arena, which makes it much easier for patients to participate and to be involved. And that is a beautiful and new and interesting and exciting area and space to be in. Wouldn't you agree, Dr. Trinh?
Yes, so many of you guys, especially the folks on Facebook, many of you guys have done these brain health consultations with me and with our team. We've always been doing it in our office in Irvine. It's a in-person visit. And what's been interesting is that with COVID and everyone staying at home, medicine in general, including research, is now moving online so that we are now doing telemedicine consultations online through through Zoom or through some kind of video chat. It's been really interesting. And I'm recognizing that patients actually like that, and so do doctors, because it pretty much cuts out your need for transportation to come see me. It cuts out the need to be on the phone waiting for an appointment. It cuts out the need to be sitting in a waiting room. to wait for your doctor to be ready. Now you can just turn on your screen and your doctor's right there chatting with you. So we've taken research, including the Alzheimer's research we do online. So we can actually do these online consultations with patients now. And then we have some pretty cool projects coming up
We do.
with research as well with that.
Okay, you threw out a lot of things there. I got to break some of them down here. So you said it's been a blessing in some ways in disguise that we've learned how to do telemedicine and people are at home and we can do things. But you said something else like it's some changes, kind of scary changes. Tell me the good and the bad of what's going on today in the world of research here. Is there less money, less time, less interest because we're all focused on other things?
Dr. Trinh, do you want to address or do you want me to throw something out there?
Throw something out there.
I'm trying to get some grenades to go off this morning here. You know, where are we at here? What should we be alerted to here?
I think one of the scary prospects is that with COVID-19, the most high-risk population just happens to be 50 and over or 65 and over, and that is our demographic. Those
Right.
are our people that are affected. If they're at high risk, if they are the high risk patients, they're not going to be leaving their homes. And I think that that's a little scary, is the prospect of not being able to go in and see your doctor for fear of being exposed to COVID. And so I think one of the most interesting things about that is that GAP and Dr. Trinh and all of our network of 80 plus research sites, we really have and continue to really be the leader in the field on adjusting to the COVID-19 environment. Our sites we're mitigating the impact of COVID-19 by featuring really important solutions to those problems, whether it be a curbside temperature check and COVID-19 questionnaire, or offering a virtual free memory assessment. It's mitigating those potential exposures that I think are really key, and reassure patients that, you know, going in to see your primary care physician or going in to see your clinical research physician, we're mitigating the COVID-19 environment as best we can, and we're leaders, we're the forefront, and so are our sites around the country.
So you bring up something that I hadn't thought of. In the midst of a pandemic, will fewer people get diagnosed? Will fewer people get treatment because they're afraid of going to the doctor?
Yes, we haven't done mammograms in the last 3 months.
Oh, yeah, wow.
We haven't done colonoscopies in the last several months.
No surgeries, no nothing.
No outpatient surgery that's elective in the last few months.
Right.
Think of the diagnoses that are going missing. We haven't made the diagnosis of Alzheimer's or dementia to take care of patients who need it in the last several months. And
in addition to the fact that, you know, if patients aren't going in to see their primary care physician, they're not getting that annual memory test. They're not getting that cognitive assessment when they go into their primary care physician. So there's also that added layer.
So this could be something, we're all talking about a second wave of the disease. There could be a second wave of other diseases or second waves of undiagnosed diseases where all of a sudden problems crop up that maybe we could have caught or addressed earlier, but for the fact that we're all afraid and frightened and staying at home.
Yes, preventive health screening, medical screening for diseases have been really put on hold. Working in the ER on a weekly basis and realizing how empty the ERs are. And I'm like, where are these heart attack patients that we normally see? Where are the stroke patients that we normally see? They're not there in the ER. It's scary because we see them every day on a regular basis. And
so what do you think? They're just staying home with a stroke, or they're just not coming?
So either heart attacks have stopped all of a sudden for the last 3 months, or folks are like just enduring stuff at home and delaying care out of fear of coronavirus.
Yeah.
It's the same thing with diagnosis that includes dementia, Alzheimer's. Those diagnoses they end up delay, and they increase the rate at how of patients getting institutionalized, ending up in nursing homes without acting quickly to try to mitigate and adjust.
So how do you keep the focus? Forget about the fear. That's hard to overcome. And you're doing offering other alternatives, telemedicine and sites and other sorts of things to keep contact with patients and to keep them talking about what's going on and finding out what's happening. So you're trying to be creative in that way. But how do you get past the focus? We're so focused on COVID, and now we're so focused on, social justice and race riots and other sorts of things that are going on. Oh my goodness, here, all these issues. How do organizations like yours keep people attention during all this?
Keeping them engaged.
Right.
Keeping them engaged and being consistent in those engagements. The one thing that I can say about the Healthy Brain Talks and a lot of our sites within our network is they are engaged with their patients, their community. It's not just about engaging one-on-one with the patient, but it's about being consistent in your community, whether it be the COVID-19 environment, what's new in Alzheimer's research. It's being consistent in those engagements and the one-on-one contact.
So,
Making it easy
so
for
well, go ahead.
making it so we're trying out something new that's really interesting.
Okay.
My favorite topic.
Innovation, right? We just like breaking
Yes.
rules. We call innovations really just breaking rules. So how when you see a doctor, you have to make an appointment.
Right.
And so that requires picking up the phone, making a phone call, waiting on the phone if you're put on hold, and then
when you're put on hold. Yeah, right.
trying to match up the doctor's appointment with your schedule. Oftentimes, doctors looks at their schedule with the receptionist, and then you look at your schedule, and you're trying to match that up. And so we are using something new over the last, it's been like about a week, a little bit over a week now, where patients can self-book. They can self-book through a link, an appointment with me to do a consultation regarding their concerns with their memory. And so what I do is like through these Zoom links, right? Through like a chat like this or through Facebook Live. And I'll show you guys. I'm going to post right now on chat, right? On Facebook chat.
Okay.
I'm going to post a link called Calendly, and it takes you guys to my schedule. So if you wanted a no-cost one-on-one chat with me and with our team about your memory concerns, about clinical trials, about if you wanted a memory test, all you do is you click on that link. It's called Calendly. I just posted in the chat there.
Okay.
And you click on that link, and it opens up my calendar so that you can book yourself. You can book yourself to have that telemedicine conversation with me, and we do it virtually online.
Now, one of the things I'm going to have to go in is have my hearing checked, because I thought you said no cost one-on-one consultation. That can't be correct. I must have COVID in my ear here.
Yeah, it's 100% correct. It's a no cost. And you guys who are on Facebook, you click on that link, Calendly / Healthy Brain Consultation, and you'll actually see my calendar pop up, and you can actually book yourself for a one-on-one consultation where we can chat about your concerns with your memory. We could, we can discuss, we can offer you a memory test and all that. And it is one-on-one, there's no cost to do that. And if you guys are interested in that, sign yourself up, and we will actually chat at the time and day that you select on the calendar that's open. So it's an open calendar of our schedule, and you pick your own time and dates.
What an obvious answer to making it easy here? I mean, why haven't others thought of this? I've seen Calendly. That's a pretty popular program. Businesses use it to schedule appointments. Why haven't doctors thought this out?
I don't know why, but we are doing it. And you guys who are online, you're welcome to schedule and have a one-on-one conversation because that's what we do. And
It takes 5 minutes. It
Okay.
takes a total of 5 minutes to fill it out and schedule it. And the beautiful part is you can also you can reschedule if need be, if something emergency comes up. So it really puts the control in the individual or patient's hands.
Now, how much time do I get with you? 5 minutes? Is this a quickie? Is this just a
No,
Oh, no.
we book out an hour with you.
what?
Yeah, you don't
can't
necessarily.
you can't just keep taking you spend 20 hours a day answering people's questions here. You got to make a living. You got other things to do here.
He does that already.
I make a living selling nose rings on Amazon.
I knew that. I just didn't want to disclose it yet. Right.
I should go get a nose ring and wear it on one of these interviews. You know,
Don't you dare.
So,
A Walking Dead nose ring. I know you're fascinated
Walking
with the
Dead
Walking
nose
Dead
ring.
here. Yeah.
so you guys on Facebook, you're totally welcome to actually try it out and book an appointment where we can check out your memory and all that. But and what we do is once they schedule an appointment through Calendly, they get an email with a link. Vivian, you can do it as often as every 6 months, or if you feel like your memory has changed, you can definitely schedule. And so you get a link, and so you don't have to show up at my office. We will be doing it virtually, just like we're talking now. And so it's a virtual visit with me and with Corinne, and we'll offer you, a memory test and things of that sort. But it's completely virtual now, guys, that we are doing medicine. And COVID just really just drove everything to where we are today. Virtual visits, virtual calendar scheduling, virtual memory testing. We're not going back to the old ways.
No, and that is very clearly indicated, especially I just a couple of things I wanted to point out is I recently attended a social media trending webinar, and the most interesting thing that I found is that obviously there's going to be a huge jump in Zoom and teleplatforms and virtual platforms. What was the most interesting to me is those community-based social media networking community platforms, as well as gaming platforms. You're seeing a lot of people transition into those arenas of social interaction. And so interacting with your community doesn't necessarily mean face-to-face all the time. A lot of people are communicating through Nextdoor and obvious community networks. And so I see the shift. So if it's shifting in that arena, it's going to shift in all arenas, meaning telehealth, clinic visits. A lot of your preventative care is going to move online, as is research. And so we're seeing a really quick transition for something that was already in the works.
How does
COVID-19 just expedited it?
Many have said that this has just expedited our shift to online that was already happening, and now we've been forced to do it, and we find out it's not as tough or hard as we thought it was going to be, and so why go back instantly to the old way of doing things here? But let me ask you a couple of questions. So have you found new ways, you found easier ways to book appointments and to keep people seeing their doctor, even if they're scared to physically go into the office? Have you found other ways to do research online, or does that still require a patient coming in and for whatever clinical studies or trials or things that you're doing here?
What we're seeing is really a decentralization of trials, meaning that the patients don't always necessarily have to come in for each and every office visit. They like to call them study visits. Those study visits aren't always going to be in-house. You're seeing a transition of clinical research protocols, including remote visits or home health visits. So it's a whole new world for research, and it's truthfully much more accommodating to the patient. If they can stay home and have a home health nurse come out and do a study visit there, fantastic. It gets them more involved with their caregivers. It gets the patient more involved. And quite honestly, it's better for the patient as well. So you're seeing a really beautiful hybrid of clinical research in a very different space, and it's exciting. And I know Dr. Trin's been in research for many years, as have I. So it's a really exciting change. Much needed change.
What do you think, Dr. Trinh? Is research going to be easier as we go forward, or as we accommodate patients and find ways to come to them rather than having them come to you?
Can you imagine doing Alzheimer's research and the difficulty of bringing a patient with memory loss to your office? Right? They're not going to make it to your office without a driver. If they have memory loss, if they have Alzheimer's, how are they even going to get to you? If you can bring the research to where they are at and the convenience of that for them, can you imagine the increase in participation with patients and the convenience of not having to worry about arranging transportation with a patient with memory loss, right?
Talk about that for a minute, because I suspect that that is bigger than we think it is. Here's why. If my mother had Alzheimer's, my late mother, among many problems, and she had Parkinson's mainly, and it seemed like that turned into some sort of dementia. Nobody knew if it was Alzheimer's or whatever, but she clearly had some sort of dementia the last couple of years on top of it. And it was very difficult to move her, to get her to go anywhere. The only person who could do that was my father, who was also in his 80s in that time. And on top of it, there was a certain, I don't know if I should put it in this term, but a certain shame, stigma, let's just keep this quiet. Let's not go out in public. She didn't like to go out in public at all. Forget about just going to the doctor. Go anywhere. Leave the house. Get out of bed. All of those were debates and discussions that took days to do. It wasn't just the time it took to get her there. It was the time it took to get her open to the idea of going anywhere.
Yes,
and if somebody could have come to her and said, hey, honey, my dad would say all the time, hey, honey, someone's here for you, and it's private, and you don't have to go through this spectacle of being wheeled out in public. She thought the whole world was staring at her. She didn't want to go anywhere. I'm going to get all choked up here again, but there was a drama and trauma associated with taking her anywhere, way beyond the inconvenience of the time, and way beyond much, much more than just the difficulty of driving her there. It took days to get her to agree to anything.
I have seen that on a regular basis, how patients with memory loss, at some point they become very secluded. At some point they become very introverted. They don't want to leave their home. Part of it's fear, part of it is anxiety, depression, agitation. And
in my mother's case, it was shame. It was embarrassment. Everybody's staring at me. I'm not going out. I'm not going to see. My mother got to the point she didn't want to see her sister. She didn't want to see any family members because she didn't want them to see her like this.
It's really common to want to socially isolate yourself with that patient population. I've seen it progress personally in my own family. So, it's very common, and you're right. It has to do with there's a lot of self-shame with it. I mean, people don't even like the word Alzheimer's and dementia. Memory loss or brain health are safe words, whereas nobody really wants to talk about Alzheimer's and dementia because it's a scary word. It's a scary diagnosis.
I'm going to use an old literary reference. We all read the book, at least I did in my era, The Scarlet Letter. And women were branded. It was adultery in those days. They were branded with an A. Alzheimer's is sort of a scarlet letter. Once you put that letter on your chest there, not only do you feel, I don't know, standing out, embarrassed, shamed, but I think a lot of people stay away from you too because they don't know what to do or what to say. So they willingly sort of, my aunt was great, and she would go over and say, but if she could avoid seeing her sister in this state, she would too, I'm sorry to say.
One of the biggest challenges in research on Alzheimer's is finding willing
Yeah,
participants.
right.
And and for the exact same reasons that you have mentioned, right? The shame of the diagnosis, the excuses people give for memory loss, and the social isolation. They don't want to leave the house, much
Mhm.
less go see a doctor.
Right.
If clinical trials is a source of hope
Mhm.
to bringing a cure to Alzheimer's, to bringing a better treatment for Alzheimer's, and patients don't want to go to clinical trials because they don't simply don't want to leave the house, why don't we bring this source of hope to their home?
Yeah. It's
You
private, it's convenient, it's comfortable, it's.
using telemedicine,
Mhm.
right? Using telemedicine, I can chat with a patient
Mhm.
at home, and they may need some assistance from, from their hubby or their wife or their daughter or son to maybe set up the call,
Right.
right? But once the call is set up, it's just a chat. They're in their chair, they're in their comfortable living room, and I'm in my chair. We can have a chat, and they never have to leave their home for the barriers that we have set up today, right? For
Right.
to bring a patient with memory loss to the office, it's a huge barrier. That barrier goes away with a video chat.
Mhm.
That barrier goes away if we can send a nurse to their house to draw blood.
Yes, right.
That barrier goes away if we can do a memory test over video, right? So a lot of this can go away. And so when we talk about global Alzheimer's research, we can make a dent in the progress of global Alzheimer's research through these new innovations, such as telemedicine.
Reach more people in a way that's more comfortable with them. Apparently, my confession here touched a nerve here. Some other people. Stacy says my grandmother's the same way. She has shame and embarrassment for her memory loss. That was exactly what my mother felt: shame and embarrassment. Uh, so if we can help avoid that stigma by forcing them to go out, which isn't easy, maybe we can see more people and see more results. So let's talk about in the last 10 minutes or so that we've got, let's give us some positive hope here. What is the state of global Alzheimer's research today? Any closer? Any breakthroughs? Any interesting ideas in the works here?
What are we bringing on board to GAP coming up?
Yeah.
Well, I do want to point out that the FDA just approved a new radio tracer, which is essentially a scan for amyloid plaque in the brain, which researchers believe is the cause of Alzheimer's and dementia.
Now say that again. You
And
threw that out real fast to me. Some sort of plaque in the brain that what?
yes, yes. And
That's a
this new
buildup in your brain that somehow what restricts the blood flow or the flow of information, or how does that work?
Dr. Trinh, I'm going to let you address that.
You guys love to
Dr.
just throw
Trinh,
this amyloid plaque in the brain. I'm
Blah
like,
blah blah
what the
blah blah
heck?
blah. Some kind of plaque,
Yeah,
right?
right.
some kind of plaque.
So
Something, right.
so first of all, there's a good question. Dan Daly on Facebook asked, "Is there HIPAA issues with video chats?" And
Ah,
Dan, the video chats that we do are all HIPAA compliant. They're
They're
all
through a HIPAA compliant platform,
yeah, the
which
platform.
protects the patient.
Yes. So that's
and HIPAA, for those who don't know, is the Health Information Protection Act or something like that. And it basically says you have a right to, whatever your health information, to keep this secure. Again, because you don't want others maybe to find out about it. You don't want the world to know that you've got AIDS or something or whatever here. Maybe people use it in judging you or giving you a job or other sorts of things. So we've created this privacy protection, this special layer of privacy protection among doctors that they have to adhere to in any interactions they do with you, right? All the information they
yes,
collect from you,
yes.
right?
And then Vicky wants to know, are we still doing the live visits in my office? Yes, we are, Vicky. We are still doing in-person
No,
visits.
we don't want to see anybody anymore. Dr. Trinh just wants to stay home, Vicky. Come on,
Yes.
get with it.
Oh, yeah. Both options, Vicky. Patients can see me in the office for the no-cost consultation, and they could certainly see me online for no-cost consultations. I'll post that link online again. It's a calendar link on the chat. You guys should try it out. You can
Yeah.
certainly schedule a visit with me live.
I expect to see a huge surge in online consultations here after this phone call
You
here.
can click on it. It's no cost. We talk about your brain basically, and
What takes place in that? Give me a
in the
walkthrough.
consultation?
Let's pretend we're doing a quick consultation. Hi, Dr. Trinh. I'm kind of nervous to do this, and I don't know where to start.
Hey, Paul. Yeah. So we are live on our consultation now, Paul. And what I want to talk about, Paul, is how to keep your brain healthy. What we can do to, optimize the health of your brain, optimize your memory. Tell me about some of your concerns, Paul, with memory loss.
Well, I hear there's this amyloid plaque thing here, and or whatever it was called. I'm finding myself forgetting these days. I'm finding myself struggling to remember little details, and I wonder if it's just age or if it's something more serious.
Yes, it's Paul. It's a concern with all of us. I forget myself sometime as well, and my wife reminds me. And I don't know if it's selective memory loss when it comes to talking with her or just general memory loss. But anyway, so Paul, you and I have in a healthy brain, we each have 100 billion brain cells.
What?
Right?
Wow.
100 billion brain cells in a healthy brain. And in a healthy brain, one brain cell will talk to the next brain cell, and they're talk to the next brain cell. So they're communicating. The brain cells are talking to one another, right? And so every thought that you have, Paul, is a pattern of brain cells talking. Every feeling that you have is a pattern of brain cells communicating. And every memory that you have is a pattern of brain cells chatting. So your memory of dinner last night could be this pattern up here of brain cells communicating. Your memory of breakfast this morning could be this pattern over here, right? So we talk about these plaques that build up. So it's not just plaques; it's plaques.
And are they in the blood? I guess that's what I was trying to get at. I think a plaque is something like a heart attack. It restricts the flow of blood, and it gets smaller and smaller, and eventually you have an attack. Something breaks down. Or is this? But a brain cell, I picture is some sort of neurons, electrons, electric communications, or something.
Yes, they're brain cells. So the plaque is not in the blood. The plaque gets in the way in between the brain cells, and it kind of blocks the communication between brain cells, so that when it's only mild and there's a little bit of plaque, your memory loss is only mild. Forgetting a word, a name, right? Walking into a room, why am I here, right? So that's when it's only mild, and as plaque builds up over time, over the years, right? Plaque is building up. Your brain cells, as you get more plaque, your brain cells can no longer kind of get around that plaque.
Sort of like a fence that keeps them from talking to each other. Huh?
Yes. And when
they got to shout over the fence or through the fence or whatever.
That's right. And so when your brain cells cannot talk, we call that memory loss. Amyloid, right, is a plaque. Now the tracer that was just FDA approved that Lisa's talking about is a tau tracer, right? Now tau is interesting. Have you ever heard the words plaques and tangles?
Plaque and tangled, no.
Yes, they're used together for Alzheimer's. Plaque builds up in between your brain cells, so they can't talk. The tau is the tracer that can now trace this protein called tau. The tau isn't in between your brain cells. The tau builds up inside your brain cells.
Oh,
so it destroys the brain cell from the inside. The FDA just approved a tracer to detect the tau tangles.
And let's talk about this for a second, because again, you're delving into we're getting into the weeds here a little bit, and that's good, because I don't really understand much about Alzheimer's, including The same thing as Parkinson's. It doesn't seem like there's a test of whether I've got it. It's all observational. It looks like you have Alzheimer's. It looks like you have Parkinson's because you're shaking, but I can't take a test and say, yep, you got it. Like I can, I don't know, heart disease or something. Yeah. Is that true?
We can see Alzheimer's. We can see Alzheimer's on specialized brain scan to look for plaques and tangle. Now, I have to say that, I have to kind of say though, that you can have plaques and tangle with good memory and no memory loss. It's possible. But if you have plaques and tangles with memory loss, that really just solidifies that diagnosis.
Because too often people are saying, if my mother had Parkinson's, they assumed. They couldn't prove it, and periodically somebody would say, well, it's something else. It's not, because we all suffer from familiar tremor. My hands shake anyway here in our family. And they'd say, well, it's just really bad case of that. Is Alzheimer's the same way? Can people get easily misdiagnosed? You do have it or you don't have it, because it isn't a test. I can't go in and draw blood and say, oh, you got it. I don't think, unless I'm mistaken.
All the time. If you were to come to me, Paul, and says, I have memory loss, I would not think of Alzheimer's as the first thing that pops up. I would do an evaluation to look for other reasons for memory loss. I would check your blood to look for your thyroid to see if you have, a deficiency in your thyroid that's not, because hypothyroidism untreated leads to memory loss. I would check your vitamin B12 levels. If you have a low vitamin B12 level, we call that vitamin B12 deficiency dementia. I would check to see if you have underlying infections.
Yeah, my aunt, for a crazy thing, this always blew my mind. My aunt was susceptible to urinary tract infections, UTIs.
Yes.
Causes memory loss.
Because, I don't want to get graphic or crude, but because she didn't take care of herself. She didn't wipe well after she went to the bath. She was old and struggling, and she wouldn't wipe well. And so this bacteria was left behind, and she was constantly, we'd knock it out and she'd get another one here. And the minute she did, the proof, I began to recognize, I knew she had one because she started acting like she had Alzheimer's. She didn't have Alzheimer's. She had a UTI.
That's right. I would check for depression. Did you know that depression causes, lack of being able to concentrate,
Focus,
which leads to memory loss?
Makes sense.
Right?
Right.
I would check your medications.
Check medications. One thing I do want to point out, Dr. Trin's really, he's very thorough in his assessment on diagnosing mild cognitive impairment or Alzheimer's and dementia. And here's the thing is that a lot of primary care physicians and general practitioners, they don't necessarily have the time or the training to do a thorough cognitive assessment. It takes a lot more than 15 minutes to really do a good, accurate assessment on your patient, whether or not they have memory loss. So I think a lot of the times we're missing the boat on patients who are potentially have mild cognitive impairment or Alzheimer's and dementia, because we need to get better at diagnosing it at the primary level.
And we're looking for some quick answer. Oh, you got a UTI. That's the problem. Here, just take this and you're done.
Exactly.
It might be deeper than that. My mother was on a cocktail of medications because of Parkinson's and some other, she had a sort of, it wasn't a one thing. She had a series of things that had accumulated over time here, and therefore she had accumulated a whole bag of drugs that she took, and I don't think anybody ever understood what's the interaction of these half a dozen medications that she's taking, because nobody ever took there's no test that says what happens when you take these 6 pills.
And that's the experience that a lot of people have when they're going through the diagnosis process with mild cognitive impairment or Alzheimer's and dementia. They'll get bounced back and forth between their primary care physician, who refers them to a neurologist. The neurologist says, I think you have situational depression. They'll send you home 6 months later. You'll bring your parent back in or your loved one, and they do a mini mental state exam, which is the pretty standard tests on the primary care level, but there are many other cognitive assessments that a neurologist or somebody like Dr. Trinh who performs these assessments, so they get a really good comprehensive profile of the patient on their cognitive capability.
So let's go back and address this because I threw out some things there. Is Alzheimer's today just an assessment that you rule out all the other things it could be and therefore it must be this? Or is it coming to the point, or has it come to the point where we can actually see, no, you got it?
We do both.
I was going to say both.
Okay.
It's a hybrid.
So it's an assessment where we rule out everything else, but we can now, especially through clinical research, we can now do that brain scan through research to look for the Alzheimer's plaque and tangle. And we do it at no cost. At no cost.
Wow.
For patients who are candidates for clinical trials. It's an expensive
Because you're looking
test.
for people that you can
Right.
try out drugs on here. I didn't want to say experiment with, but you're sort of looking for people that have these. You want to make sure you got good candidates, that you're not giving an Alzheimer's drug to somebody that is just depressed or has a UTI, and therefore.
That's right. If I scan your brain and I don't see plaque and tangles, you don't have Alzheimer's. I've ruled it out. We can be pretty definitive with it. So we've gotten the science to that level where if you don't have plaques and tangles, you don't have Alzheimer's. So we're very precise in our diagnosis now.
And
again, we do this at no cost for patients who are interested in, doing these consultations with us online.
And how do they find out? That would be worth it right there, just to go in and have the test done. If you're experiencing any of these symptoms, to either rule it out or suggest that may be what you have here. Is there a site to go to? How do I get this test? I would think everybody want this test. Everybody at a certain age starts to feel any sort of memory cognitive loss here.
So this test is available depending on the specific clinical trial that folks are enrolled in. Some clinical trials, most clinical trials I know that involves Alzheimer's do offer this test. The key thing is you have to be eligible, you have to be a candidate for the clinical trial.
Which means
Not
what? That you're the right age or you have some other...
right age. I mean, you can't walk in, you're 13 years old and you want that test, right?
Right.
And if you're 105 years old, you probably won't get that test either, right?
Right, because they're going to assume 105 you just got other reasons you can't remember.
So,
you're just
so there
old.
are certain. If you're 105, I want to know how you got there.
Yeah.
I know.
I want to learn from you, right?
Right.
But so through these consultations that patients do with me, we kind of help tease out if they may be a candidate or not. And the consultations are free. I posted my link there with Calendly, and patients just go and pick their own time.
It's full for the next month. I didn't want to tell you this, but you're full now here.
Right. And so these tests are offered for those who are participating in these clinical trials, which is cool because it's no cost as well. But do you know the primary reason that we miss the diagnosis of Alzheimer's?
I don't.
The primary reason we miss the diagnosis of Alzheimer's is that everyone thinks memory loss is normal when you're older.
Right. I do.
Everyone,
yeah.
It's normal brain aging is what I hear a lot.
Yeah. Right.
That's the primary reason we miss this diagnosis until it's too late.
Well, I saw that with my own mother as she started to go into this, and the doctors pretty much took us aside and say, "What do you expect? She's old. What do you want me to do about it? She's old."
No.
Right? So go home. She's old. This is the start, and it's not going to stop, and get used to it, and,
Well, part of the problem from the doctor's mindset, right, being a physician, is this. Part of the problem is that we do not have an FDA-approved medication that cures this disease of Alzheimer's. It's the third leading cause of death in Orange County.
Wow.
Fifth leading cause of death in the United States. We don't have an FDA-approved medication that stops it slows it down, or cures it.
Right.
So a doctor's mindset is like, why do I even want to make the diagnosis if there's nothing that I can do about it?
Exactly. I just felt like the doctor said, come back when you got something I can take care of. But you got something that I can't stop, I can't reverse, and I can't slow down. So why are you here?
And these doctors don't have access to refer the patient for imaging, because the imaging that is required, the PET scans, they're not covered by commercial insurance. Truthfully, the only way patients can really access and get these PET scans are through participation in clinical research studies.
See, there you
because
go again. Right.
insurance companies don't reimburse providers to send their patients in to get these scans.
So we've set up a system where the doctor may or may not have the time to properly diagnose this because it's a series of exclusions. How about this? How about this? How about this? They may not have the internal incentive. Maybe incentive is the wrong word. It's just they're uncomfortable. Why am I even going to get into this? I can't help it. I can't fix it. I can't stop it. So, I'm reluctant to even get into this whole neighborhood of disease. And then
it's hard to want to diagnose when you can't treat.
Yeah, right. And then you've got to then the only way I can definitively tell whether you might have this are expensive tests that I don't get reimbursed for. You don't get reimbursed for. So why are we even bothering this? So therefore, go home. That was the overriding message. There was no discussion of having to help my mother get a healthier brain. It was all about preparing us that this is the beginning of a long slide into darkness, and we're really sorry for you, but next,
And this is why Alzheimer's is the third leading cause of death in Orange County, because of this mindset, right? There is hope in Alzheimer's if you get to the patient early with clinical research, because we have medications that are, that has the best hope with the goal of removing plaque, right?
I didn't think there was any hope. I was going to ask. I didn't think that once you get this plaque, you're done. You can't go out and scrub it. They can't go in and with a brush and clean it out or something here.
In clinical trials, we have medications designed to remove plaque.
Wow.
The key thing is you have to catch it early. You can't do it when your diagnosis is advanced and half your brain is gone. Right? But we're not catching it early because we're blaming it on aging, and we have this conception that there's nothing we can do about it.
Right.
Alzheimer's Orange County has support groups for free. Alzheimer's Orange County has classes, they have education, they have one-on-one, they have these brain exercise classes that are offered throughout the county. So there are things that can be done actively. There's nutrition, there's foods, right? There are things that are evidence-based.
Activate your brain. Activate Your Brain is a GAP initiative that talks about all those things, the social aspect, the social engagement, dietary, active lifestyle, doing things that are cognitively stimulating. The last pillar is get involved in clinical research. I think Dr. Trin's right. There is a lot of hope. I mean, look at his brain health assessments that he provides at no charge. These brain health assessments are so key because it really gives patients and people a baseline of what their memory is, of what their cognition is. So every year that they come and get that annual brain or cognition assessment, they're going to have that baseline. So when they come in at year 3 and they've got a small change, we're catching it early.
So I hope, here's where we're going to wrap it up today here, because you've given me some hope. I thought there was no hope. That was the message I got loud and clear from the doctors. Sorry, we're not really sure. It would take too much to find out if we're really sure, but just look at her. She's old. She's got it, and there ain't nothing we can do about it. So I feel bad for you, but, can you step out of the way, please? We got to see somebody we can help here.
There's hope on the horizon. Biogen announced they're going to submit to the FDA for an approval for a new Alzheimer's medication. The new radio tracer was recently approved not even a week ago. So there's definitely hope on the horizon.
So how do we get in touch with you right now if they want to get involved in clinical trials and learn more about GAP and all your initiatives? Let's give that out first, and then I got one more question after that.
Sure. If they want to do a consultation, right? for a no-cost consultation with me, and that includes a memory test at no cost and all that. I will send my.
You're going to go broke doing this, but go ahead. All right.
I'm going to put my link on there. Now, I would love to do no-cost consultations. Of course, if you are a candidate for clinical trials, you have to be close enough to be to Irvine so you can get these brain scans. You can't live in another state and participate with me, right? So these consultations are really for if you're close enough to us to participate in clinical trials, but there are no costs with that. So the link is on there, guys, on Facebook. Click on there, click your appointment where you want to see me, because my calendar is available. Telemedicine is really
and it's filling up fast, now, folks. And then the GAP program, the GAP thing, how do they find out about it?
We are all throughout North America. We have 80 plus clinical research sites across the country for all that are specializing in Alzheimer's and dementia. The link is the globalalzplatform.org, and our homepage has a map with all our sites throughout the country. You can click on the little dot, and on that dot will be the location and contact information for any clinical site within your region that is performing a global Alzheimer's platform study.
Fantastic. So my last question, can we arrange a time for you to come back and talk about this Activate Your Brain program? I want to hear, we've heard about the difficulties of diagnosing. We've heard about the things that keep people from getting diagnosed, the fear, the shame, the difficulties of getting there. We've talked about the lack of time and lack of resources and lack of things, all the lack that keeps people from getting the right answers and stuff here. Let's talk about how can we activate our brain? Once you find out that you've got it, how do you fight it? What is the hope? And how can we activate our brain to stop it, delay it, whatever we can do to battle this disease? Let's do that another time. Can we do that?
Absolutely. I'd love to talk about Activate Your Brain. It's one of my favorite initiatives through the GAP program.
I'm going to let Dr. Trinh set it up either next week or some other week here, but I'd love to hear about positive steps we can take to activate our brain today here.
Let's do that next week. Otherwise, I'll forget.
See, I knew we were going to work that joke in.
I talk to you every day, almost.
I see a comment on Facebook here that says, Dr. Trinh, see you on Zoom at 9 o'clock with a question mark. and it's funny because I started doing these Zoom lectures on Zoom with patients and with those. If you guys want to, and last week I was supposed, after we did our on-air thing, last week I was supposed to go on at 9 o'clock to talk about memory loss, and I forgot all about it.
You forgot about it. Oh my goodness.
There were patients waiting for me on Zoom and I just forgot. My memory isn't that great. So thank you, Sunshine, for reminding me to go on Zoom in the next 5 minutes to talk about health. And so thank you for the reminder.
For those of you online, there's a continuing conversation coming up in 5 minutes. For those of you listening here on OC Talk Radio around the world, come back and check in each and every week because we address the health issues on your mind here with Health Talks with Dr. Trinh.
Awesome.
You've been listening to Health Talks with Dr. Trinh, the one show that tries to take a look at all these complicated subjects and put them into terms we can easily understand to give us hope and help where we need it.